All right. Daryl, do you have some feedback for your pharmacist?
Sure. That was a really nice introduction. It was quite at ease, so that's good. And it demonstrated, what I really liked was that I was able to try this along with you as you were saying it. So I think it really helps for you to have yours, and I can use this one. So that was very helpful. And I think all the steps were fine. Thank you for for telling me to take it out of my mouth. That was good. Otherwise, I'm sitting there with my mouth around the thing. So, but yeah, that was all very clear and very nice. When it came to the medication thing, I know that's hard. It's hard when a mistake has been made and you've got to deal with it. So then all of a sudden I felt a lot of nervousness on your part, a little stumbling here and there. But it's really okay. I think if you just make your apology and just kind of get on with it. I mean, I don't know what you're taught to do in your class, but me as a patient, if you go overboard on the apology, or we've already settled the matter, and then you go back and you apologize again or bring it up again, it's kind of like, oh, yeah, I don't want to go there again. So, I think you didn't. I don't think you went overboard or anything with that. Yeah, I think just make your apology and say, here it is, and we'll take care of this matter. I think the taking it seriously, we take these matters seriously, and we'll document it so it won't happen again. Almost, well, I don't know. Just as a patient, I don't even want to hear that it might possibly happen again. I think if we keep that out of it, I don't know how the teachers feel about that. But as a patient, if you don't bring that up, I'm not going to think that it's going to happen again. So, because I wasn't that worried about it, they just look different, So, and I think if the patient doesn't seem all that worried about it, don't make them worried. But otherwise, yeah, the demonstration of this was really good. So,
I thought you did a fabulous job. I mean, there's a couple little, details that Lori brought up that I think are really important. But overall, Stephanie, you have a great style. I don't know if I've gotten to listen to you yet this quarter, but I thought you did a tremendous job. You're confident and you're knowledgeable. You're organized with what you say. Your word choice, to my ears, was appropriate all the way along. You didn't stumble really, and there weren't too big of words or anything like that. So I really like your style and your approach. And the little extra added bonus things that you did were really good. So these were things like, at the outset asking her, oh, is this for you? Are you picking this up? That's a nice extra thing to do because we haven't really practiced that much. We just assumed that, whoever's in front of you is a patient you see, and asking her about any new allergies or medical conditions is really good too, because we haven't really emphasized that too much either. I really liked after you had her demo and then asking her, so how did that feel for you? That's really good too, instead of just blowing on to the next bucket full of information that you need to talk with her about. So that was really good too, except a little more of that patient-centered thing that we're working on. Blah, 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 blah. Yeah, I thought you did a great job. I think the only things, and I just need to ask a couple questions too of some things I might have missed, but the only things that you could probably do a little bit differently if we did this again would be, like, I think at the outset, and we'll practice mid-air stuff again next quarter, I think, toward the end of the quarter again, to help you guys better learn, because we kind of just gave them an introductory framework to start with, and not so much about how you can adapt that framework to the situation, to the person in front of you, you know what I mean? So, I mean, I think what you did was really good. The only thing that I heard that we probably could have tweaked a little bit was, like, early on, she's very matter of fact, like, oh, they just look different. And then you said, well, something about, like, oh, well, this must be worrying you. And it's really good, again, to have some empathetic statements. But when your patient doesn't necessarily seem terribly emotional at that point in time, and sometimes those statements are kind of misplaced, if that makes sense. Like, I just made a note like, well, it was good to be empathetic, but she didn't seem at this point too worried. But it was good, because again, we want you guys to practice, because normally people might be really upset, especially if it's wrong and they've taken some. And that was one thing, I don't know if I heard, did she ask you if you had taken any medication? Is that? Yes, she did. Okay,
she did.
I thought it was just writing something. And the other thing I think I may not have heard was, did she talk with you about any refills or follow-up on the inhaler? I don't think so. Again, not super duper critical. I mean, certainly not as important as some of the other information, but it's always nice to discuss that, especially if you know that maybe the refills that are on there may not be adequate for her whole length of therapy, so it's good to check in. Yeah, the only other thing, Stephanie, I think that would have been great, but we haven't really practiced this much with you guys either, is that when you give her that new bottle medication, you could actually open it up and say, does this look like the one that you normally take, just to have that last final step. And I think that also ensures confidence with the patient. Yeah. So I think the only thing outside of that first empathetic statement that you made, the only other thing that I was kind of that I think Lori picked up on was, I think you said something like, well, this doesn't happen very often. It's like, and that may be true, but it's probably not anything we'd want to say out loud. Because then I'm thinking to myself, what do you mean? This has happened before? I mean, and the reality is that errors happen, but I think usually they don't cause harm, and so it doesn't usually get brought up that often. And the only things usually get brought up, like in the media, are things that are harmful, lawsuits and that kind of stuff. So that was probably a little phrase you could have left out. But I know what you were doing, because you're trying to have a conversation and assure the patient that this is not our standard mode of practice, and we're really sorry, and very unhappy if we caused you inconvenience. Yeah. So, but I thought, 99% Stephanie is awesome. Did you do the patient counseling competition this year, by chance?